Talking medical news today, and as we say, welcome back. The opioid and fentanyl crisis has been affecting our country for years. The big tool to fight back is actually becoming more prevalent. We've been talking about it on the news. Narcan, you've heard us talk about it, but we're having more of an in-depth conversation.
Naloxone, yes. Joining us to talk about it, Dr. Max Brookman from OU Health. Doc, thanks for joining us. We appreciate it.
Of course.
What are you guys seeing at OU Health as far as fentanyl and overdoses?
I mean, nationwide and statewide, we've seen an increase in fentanyl overdoses. Over in the Children's Emergency Department, we are seeing an increased amount of fentanyl overdoses. There's more on the street, and so there's going to be more in the home, and kids get into it.
And it can even be accidentally that they get into it, correct?
Absolutely.
Yeah. I mean,
and the side effects from opioids like fentanyl causes depression in your breathing, your heart rate, your blood pressure, and so these kids will come in oftentimes near comatose.
Oh my goodness.
Yeah,
it's shocking to hear.
Is.
It's horrible for adults, but when you hear children involved too.
Yeah.
So we've heard naloxone and Narcan. Explain those and how it works. Naloxone is the drug. It's branded as Narcan, correct?
That's correct.
Okay,
Naloxone,
and how does it work?
So it works to reverse all the effects of opioids. So opioids like fentanyl or morphine, they have certain effects on the brain. One of the use is that it's a extreme anti-pain medication. However, the side effects include respiratory depression, your breathing slows down, and that's where the serious side effects come from. So Narcan helps to block those receptors in the brain and reverse almost immediately the effects of opioids.
And is it a nasal spray? Is it a shot? For folks that have no clue, kind of how do you administer it, I guess?
It comes in a variety of delivery systems in the hospital, but over the counter you could buy a nasal spray, so you can inject it into either nostril, and you just, well, I think I have some right here.
Yeah,
somewhere.
Go ahead and grab it. So, and if you see someone down, you can put it right up in their nose and spray it. Is that what you're saying?
And there's, you know, there's not been any reported side effects of giving it when you don't need to give it. If you see anyone who's not responding and you suspect that they might be taking some kind of opioid, maybe ingested fentanyl, just put it into the nose and spray.
Okay, there's no negative to it.
We've seen police officers save people's lives on, you know, certain crime situations, but, you know, where can folks get this? And I mean, do you suggest that everyone has this on them or in their car, or that you might come upon someone that needs this?
I mean, I always keep it in my car. I know a lot of people, my wife included, who keeps it in their purse. I used to live in New York City, and it wouldn't be uncommon for you to be walking down the street and seeing someone completely unconscious.
And where can you get it?
You can get it over the counter. You don't need to go to a doctor. You could buy it from any pharmacy.
And you've got some parents listening right now. Any message to parents this morning about what you're seeing?
If you have fentanyl in the home, keep it locked up. Keep it away from the kids. Have Narcan at home. It can save lives.
Yeah, and it's literally happening, and you guys are seeing it in your ER. Okay.
Dr. Max Brookman from OU Health, thanks so much for joining us this morning. We appreciate your insight.
Of course.
Great interview. All right.